Hello everyone, my name is Danielle and welcome to or back to my channel. So today's video is the final video in my series and I just wanted to take a moment to thank everyone who has interacted with my videos. If you've liked, commented, shared, whatever you've done, I really appreciate all of the support that I've gotten. It's definitely made doing this independent research project a lot easier. And yeah, I just wanted to thank everyone for that. With that being said, I feel like I've saved the best video for last. So in today's video, we're going to be talking about diabetes and diabetic foot. So this video is quite similar to the last video that I just did on my series, which was diabetes and wound healing. So if you haven't watched that one, I would highly recommend that you go back and watch that one first. But of course, I'd like to start out with my usual disclaimer that I'm a student dermal clinician studying my Bachelor of Dermal Science. I do not specialise in diabetes and I do not have a medical background. This video is all for educational purposes. This video does not take into consideration your personal journey, so if you are experiencing any of these skin conditions, please go and see a dermatologist or a dermal clinician to get it treated, as well as an endocrinologist to help treat and manage your diabetes. Okay, now that that's out the way, let's get stuck into the video. The World Health Organization defines diabetic foot as an infection, an ulceration, or a destruction of the deep tissue of the foot. Diabetic foot ulcerations affects 15% of diabetic patients and 14 to 24% experience lower extremity amputations. And did you know that 70% of leg amputations are performed on diabetic patients? This is why it's imperative that action is taken if signs are presented early on. An underlying factor that affects all diabetic foot ulcerations is poor vascular flow, which, if you remember from my last video, is essential for wound healing. So if you're a diabetic and you're watching this video and you're a bit worried about the warning signs, the main warning signs that you should look out for is redness, swelling, and pain in the area. If this remains untreated, bacteria can actually invade the ulceration and it can actually go right down to the deep bone. A lot of the time, individuals who suffer from diabetes will also suffer from some kind of motor neuropathy. This is known as diabetic neuropathy in diabetics, which makes a lot of sense. This can cause weakness in the muscles of the foot and the leg. Diabetic neuropathy is caused by high blood sugar levels accumulating over a long period of time, and of course, as you can imagine, this is more prevalent in those with type 2 diabetes. This can result in a loss of sensation over time and abnormal walking patterns, which can put a lot of pressure on the plantar aspect of the foot. This may result in muscle impairment and deformities of the foot. Furthermore, neuropathy can actually result in an absence of sweating, which can lead to dry skin and cracks, and then this is where the toxic cycle begins. So ultimately, diabetic foot is as a result of impaired wound healing, which is what we discussed in my last video. Practitioners will often use an algorithm to determine the severity of the diabetic foot. The 4 steps include assessment, clarification, staging, and intervention. They will also consider motor neuropathy, which can be presented as an arch in the toes of the feet, autonomic neuropathy, which is the dryness within the feet that leads to the cracks, and sensory neuropathy, which of course, as you can imagine, is the loss of sensation within the feet. The practitioner will inspect the foot and they will look for colour, deformities, necrosis, and infection. From here, the practitioner will generally recommend a series of treatment and management options, including general patient education surrounding foot hygiene and self-inspection. Injected liquid silicone has been proven to increase soft tissue thickness. It also decreases foot pressure and reduces callus formation. Appropriate hosiery and footwear is essential. Padded shoes and hosiery have been proven to reduce high foot pressures and give all-round protection to high-risk diabetic patients. Adjunctive therapy has been used to stimulate a platelet-derived growth factor called becaplermin, which was the first growth factor that was approved for treating diabetic foot ulceration. That is all for today's video. I hope you guys have enjoyed this series. I've absolutely loved completing this series. I hope you guys have learned something through all of my videos. If you could please like and comment on this video, that would be greatly appreciated. Every little bit of feedback helps. If you guys want more from me, you can go ahead and follow my Instagram page, which is dermalbydani. I post quite frequently on there, so you can follow along my journey within this industry. Thank you so much, everyone. I hope you all enjoy the rest of your day. Bye, guys.